Welcome back. As a reminder, if you need assistance today, the help desk is available. Hello, everyone. I'm Dee Bonnick, a family consultant with the Capacity Building Center for States. Family consultants have both lived and professional experiences within the child welfare system. I've been a consultant with the center for over 5 years, and I will be your moderator for today's session. I am so excited to welcome you to our session on building a culture and climate that supports a prevention-focused system. Please note the resources for today's sessions are available in the handout window below. In our session today, you will hear about defining culture in the context of child welfare and how it manifests our systems. You'll be able to recognize aligned preventions with your agency's values and culture, and you'll be able to address gaps and apply foundational strategies for building community and agency cultures towards a focus on prevention. This session will begin with speakers from New York City, Oklahoma, the Quality Improvement Center for Workforce Development, and the Muscogee Creek Nation, who will share their experiences in building and supporting prevention-focused child welfare systems. The presentation will be followed by a facilitated panel discussion with all of the speakers. I am going to now introduce you to our New York speakers. Dr. Jacqueline Martin is the Deputy Commissioner for Prevention Services at the Administration for Children's Services in New York City. Karen Resnick is an Acting Deputy Commissioner for Child and Family Wellbeing and Associate Commissioner for Performance Management at the Administration for Children's Services in New York City. And Emily Lopez is the Director of Our Place Family Enrichment Center, Grand Wyndham in the Bronx. Welcome to our New York speakers. Our Oklahoma speakers include Dr. Deborah Shropshire, who is the Child Welfare Director at the Oklahoma Department of Human Services, and Lindsay Lear, who is the Vice President of Programs at the Arnall Foundation in Oklahoma. Welcome to our Oklahoma speakers. We're also lucky to be joined by two presenters who will speak to the prevention-focused work happening within 2 tribal nations. Candace Fleming is an implementation specialist with the Quality Improvement Centers for Workforce Development, providing support to the Eastern Band of Cherokee Indians in North Carolina. And Kimmy Wynn Hummingbird is the Director of Children and Family Services Administration for the Muscogee Creek Nation. Welcome, Candace and Kimmy. I am going to first turn it over to Deputy Commissioner Martin and the New York City team.
Thank you, Dee. We are excited to share with you the prevention work happening in New York City. To support the well-being of all children in New York City, ACS developed and implemented a primary prevention strategy to intervene with families before harm occurs to children. For many years, we have invested in a robust secondary prevention services continuum. Usually after child protection investigates a family and or court mandates, services are offered to families with one or more risk factors associated with child maltreatment and neglect, such as parental domestic violence, mental health, substance abuse, and poverty. These services are all home-based. They're offered in the home of the families with varying levels of intensity and with the primary goal of stabilizing the family and reducing the risk of foster care placement. Primary prevention activities, on the other hand, at least as we approach it here in New York City, are directed at the general population with no history of child welfare involvement, or families who are emerging from the child welfare system, or families who are in crisis. Primary prevention is universal, and it attempts to intervene and support families before maltreatment or harm occurs to children. Therefore, primary prevention, the way that we intend it, is less intrusive in the lives of families. And from a social justice perspective, it reduces the number of child protection investigations of poor Black and Brown families and the need for secondary interventions. often these secondary interventions impacts a family's well-being. For example, creating barriers to economic mobility as a result of child welfare involvement. The work of primary prevention is held here at ACS in the Division of Child and Family Wellbeing. And it is my pleasure to turn this over to Deputy Commissioner Karen Resnick, who will tell you a little more about this work and where we are right now.
Thank you, Dr. Martin. In 2017, the Administration for Children's Services launched a 3-year demonstration project consisting of 3 family enrichment centers, which are a family-centered primary prevention model where all members of the community have access to and benefit from activities and programming. The FECs are warm, inviting home-like spaces where neighbors can connect, contribute to their community, find resources, support each other, and build protective factors that help families thrive. The implementation of family enrichment centers was led by ACS's Division of Prevention Services, and the planning process included input from a diverse team of community partners, child welfare leaders, and regional site visits to family and support centers. With private foundation support from the KC Family Programs, we were provided with over 18 months of research on various models that resulted in our FEC design. ACS also worked with teams of national experts in the following areas who were contracted to advise and provide training in the following key areas of the program: implementation science, appreciative inquiry, which are strength-based programming, parent-led engagement and leadership development processes, and economic mobility. The FECs are designed to be staffed by a small core of 3 individuals hired in collaboration with ACS and supported by a core group of parent leaders. They are free of charge and open to all members of the community. And in New York City, there are 3 FECs that are in the following communities, each with their own unique name that was selected by community members. In Brooklyn, East New York is called The Crib. In Bronx, High Bridge is Circle of Dreams. And in Hunts Point, Longwood is Our Place. The Hunts Point Longwood areas of the Bronx receive primary prevention services through Our Place Family Enrichment Centers under the leadership of Emily Lopez. I'm happy to introduce you to Emily Lopez.
Hello, everyone. Excited to be here. The key elements that make the Family Enrichment Center innovative are as follows. We combine primary prevention services, which are designed to reach families proactively. We work in partnership with community members through the 7 protective factors. The FEC's primary identity is driven by families, community members, and partners. Together, we support children, families, and individuals who walk into the center initially for a cup of coffee and someone to talk to. The simple gesture immediately addresses social isolation. We apply an equity lens in planning and implementation. The FEC offerings constantly pivot to address community needs and concerns. Together, we work to make this happen the moment our FEC doors open each day. This allows us to be intentional, further amplifying community voice and support already existing gems in the community. The third staff at the FEC is the space. The space rises to meet community when they enter. Everything about the center, including the name, the physical layout, and the offerings it provides, is co-developed with the community. The FEC Advisory Council members and each FEC are advocates who support and guide the work along with the staff to keep us consistent and grounded. Next, we will view the video that demonstrates the work of the Our Place volunteers. Miss Millie is a longtime resident and activist of Hunts Point. She will show you what Miss Millie's Closet, a safe space, has been able to acquire and support the community with.
We at the FEC here at 940 Garrison, we have open arms for everybody and anybody. Many people bring to my home whatever they don't want to use any longer. I could stretch out and help anyone that's in need with no questions asked. And everybody contributes to this. You could notice when a person is in need of something. It breaks my heart when I see children like that today. There's no necessity for anyone to have a child out in the cold. And for any necessity, they welcome here. They're free to anything that's placed on the table. They're also welcome to tell me if they need something that they could not get. So I will try to stretch out and help anybody that needs anything for these holidays. So the FEC means a lot to this community. Very much, a lot. Myself as well as the staff here, we do lunch and dinners, Christmas little celebration, Halloween celebration, back to school celebration. So we do little things, but the little things never stay little. Sometimes we shut this place at 10 o'clock in the night.
The video is a shining example of a community gem. Now I will send it back to Deputy Commissioner Karen Resnick. Thank you so much.
I am pleased to share with you the preliminary findings from an evaluation that was conducted in March of this year by Youth Studies Incorporated. And this evaluation really helps to provide evidence to support the following conclusions. The survey responses from our FEC members provide significant evidence that the centers are having a positive impact on strengthening a range of protective factors associated with reductions in abusive behaviors and reports to Child Protective Services. 72 of respondents reported an improvement in their social support since joining the FECs. 61% of respondents reported an improvement in their family functioning since joining the FEC. 52% of all respondents reported an increase in their familial nurturing and attachment since joining the FEC. And 47% of respondents reported an increase in their positive outlook since they joined the FECs. Surveyed members reported significant increases in their access to advice and resources in addressing several life changes, including financial issues, advice on relationships, and advice on food and nutrition. Access to advice on managing stress increased by 51%, and access to advice on parenting increased by 48%. Technical assistance is provided to FECs as follows: regular planning and reporting meetings, trainings on the program components, active external collaborations with health and human service agencies, and annual ACS-sponsored events held to showcase, and ACS FEC planning retreats. What's next for our FECs? Our goal is to ensure alignment between family enrichment centers and our community partnerships, which is beginning to occur in the 3 communities where partnerships operate. We're trying to get funding so that we can scale to provide services in more than the 3 communities that have a solid service infrastructure and high child welfare involvement. We believe strongly in the FEC model, and now we have the evidence to support that they are working. And our goal is to be able to support the existing 3 communities and ultimately support additional communities.
Thank you for sharing your experiences in New York City. I enjoyed hearing the family enrichment centers and how parents and communities are partners and leaders in running their centers in their very own neighborhoods. Nothing speaks to culture and climate more than that. What an exciting model for effective collaboration and meaningful partnership. Up next, I'd like to turn it over to our colleagues in Oklahoma, and we'll start with Lindsay.
Thank you, Dee. Dr. Deb, we've had the opportunity to partner on several projects over the past 3 years. Could you tell us, how did Oklahoma's child welfare system get to the place where it had staff and leadership dedicated to community partnerships?
Yeah, I think that's a great question. Like many systems, child welfare here in Oklahoma was under pressure to improve its system. And with that effort came the realization that this work could not be done alone by one single agency. That in fact, no single agency really would be able to bring about the kind of change and outcomes that Oklahoma wanted for kids and families. It would take a community effort. And so the child welfare director at the time recognized the need for staff within child welfare that were skilled at building community partnerships and also dedicated really to this work as opposed to being pulled in lots of other different directions. She also believed that community partnerships needed to be represented at the child welfare executive team level. So there were staff kind of in the field as well as at the executive team level. And that you would have a fully integrated community partnerships effort within the child welfare space. So she actually created a deputy director position to fulfill that leadership role. I had the opportunity to serve in that deputy director role. And when she called me about the opportunity, I said, what would we do? And she said, I don't know, we'll make it up. And we've been making it up ever since. But clearly the commitment in Oklahoma was to say child welfare needs partners and is willing to dedicate resources to that partnership. It's important to know that it was not just a sort of a public relations or PR kind of effort. It really was the beginning of a working team with accountability for outcomes. And over the past, in fact, 8 years, that team has collaborated with a variety of partners to bring millions of dollars in resources and value to those served by the child welfare system. Now, Lindsay, you and I have had the opportunity to work together for a while. And I think Arnall Family Foundation is unique in its interest in child welfare. And I'm curious your thoughts on how that interest came about and also how it is that we have value alignment.
Absolutely. When our trustee, Sue Ann Arnall, created the Arnall Family Foundation back in 2015, she was aware of the immense need that existed in our state's foster care system, and that child welfare served some of the most statistically vulnerable children in our community. And as a foundation, our philosophy is to go where the need is, but specifically to look for gaps and opportunities for partnerships. So under this context, and really what you just articulated, Dr. Deb, Oklahoma's child welfare system was ripe for partnership. As you said, DHS had recently formed a community partnership team, and they knew they needed help, but more importantly, they were willing to accept the help and be transparent. I have to be honest, when the foundation began partnering with DHS, it was met with some skepticism, especially from the philanthropic community. Other foundations in our state felt like DHS simply could not be trusted, and that community partnerships were just the flavor of the month, so to speak, and they would be gone in no time. So I spent this first several months defending our partnerships and our investments with DHS. But because our values in collaboration, transparency, innovation, mutual investment, and most importantly, improving outcomes for children and families are aligned, we have been able to do some pretty incredible things together. And as a result, I'm really pleased that other foundations are also investing in child welfare, unlike ever before. Dr. Deb, speaking of community partnerships, what are your thoughts on what qualities make a great community partnership? And on the other side, what are some deal breakers?
Yeah, I believe that great partnerships really must begin with shared values. That can take a little bit of time to develop that because partners sometimes have to get to know each other a little bit and allow each other some room to grow and learn. But we have to move forward with shared values to be able to be effective. Great partnerships also require honest communication. and the willingness to share resources. The state had the habit of inviting stakeholders to the meeting, and often because there was some kind of requirement somewhere, a federal requirement or something to do that, but didn't necessarily always listen to the voice of those stakeholders or include them in an ongoing way in the process. And so true partnership to me really didn't just mean I invited someone to the meeting. It meant that we were actually going to work together and we were going to share decision-making and resources. It also requires a lot of grace and willingness to work through disagreements and misunderstandings. That's where the shared values can really come in handy, because when there is a disagreement, we can come together around what our values are and typically be able to move forward. A major deal breaker for me is conflicting values. If I'm trying to move forward, for example, in strengthening biological families, and my partner is trying to move in the direction of rescuing children and giving them new families, well, we have maybe a conflict in our values, and we're going to have to align better if we're going to be able to move forward effectively. Initially, the state was so unused to having community partners, we sort of said, we'll take all the help we can get. But as we've matured in our community partnership efforts, we've recognized that there are times when it's better for our partnerships to potentially to go in different directions because our values are not shared. So there are, for us, some deal breakers. Now, Lindsay, as a private foundation, Arnall gives out grants to enhance its social missions, but you all have also been on the forefront in Oklahoma of impact investing. And I've had to learn about what this looks like for us as the state. Would you talk about how Arnall is leveraging impact investing to accomplish your strategic goals and how you've done that specifically in the child welfare space?
Absolutely. And I think we're all still learning. It's all changing so rapidly, but impact investing by definition is investing with the intention of generating not only a social return, but also a financial return. By comparison, a typical grant that we give out meets a social return, but there is no expectation whatsoever of a financial return. That's where impact investing comes in. And there are several different types. There's mission-related investments, there's program-related investments, and social impact bonds, also known as pay for success. And at the foundation, we see impact investing as part of our giving strategy alongside traditional grants. But the benefit of impact investing is that if there is a return, those monies can then be reinvested to have an even greater impact. For example, last year, the Arnall Family Foundation entered into the state of Oklahoma's second Pay for Success contract. This contract was between the foundation and the Oklahoma Department of Human Services to expand a tertiary prevention program and then use the savings yielded when children were safely kept in the home versus entering foster care to repay the investor, which in this case is the foundation, only the principal amount invested. This particular prevention program is offered to families that meet criteria, and if they do not accept the service, in most cases, children are removed from the home and placed in foster care. So this is sort of a last option before foster care. And there are three reasons I want to point out why we were interested in investing in this program using Pay for Success. First, it was already being independently evaluated. All Pay for Success contracts must have an independent evaluator to ensure outcomes are accurate and that the program is adhering to model fidelity. So we had the data to support the success of the program and well-documented cost savings. Number two, the leaders of the Department of Human Services were willing to sign a contract with the foundation stating it would make success payments for every case that was successfully diverted from foster care 12 months post-intervention. Now, we knew that was a risk, and several people told us it was a risk, but because budgets are constantly being cut, but because we had built such trust with the department, we felt comfortable taking it on. And number three, while the cost savings and the ability to reinvest dollars is important, at the end of the day, we chose to expand this prevention program because parents are getting the support they need and their children are safely staying out of foster care. And ultimately, we're helping to keep families together. Dr. Deb, we've talked about partnering with philanthropy like the Arnall Family Foundation, but what are some other community partnerships and what role do they play in prevention?
I mentioned that when I started in the deputy director role for community partnerships, that we didn't really have much of a plan and we were just making it up. So I just defined a partner as anybody outside of the Child Welfare Services division who wanted to help. That included other divisions in our department, our safety net divisions and developmental disabilities. It also included other agencies, and it also included a variety of community partners in a lot of different spheres of influence. One significant sphere in our state is the faith community. Oklahoma has more than 6,000 churches, as well as synagogues and mosques, and a large number of our community nonprofits are actually faith-based in origin. So connecting with that network of Oklahomans and of nonprofits was really, really important piece of our local strategy for how to engage community partners. We also have 38 federally recognized tribal sovereign governments, and we needed to partner well with those governments to be able to carry out excellent child welfare practice, especially as it related to Native children. And so actually a partnership between the state, tribes, and the Court Improvement Program resulted in Oklahoma being awarded the largest grant, federal grant, related to ICWA practice improvement that has ever been issued. So we're very proud of that partnership. And then as far as prevention work goes, I believe that community partnerships are critical in successful prevention work. Child welfare leaders have a tremendous opportunity to lay out a vision for what child abuse prevention and strengthening families looks like. Because we've seen the effect when families don't have what they need on the front end. But child welfare, as a general rule, will not be able to do real prevention alone. Family First has opened the door for a lot of conversation between child welfare agencies and community partners around prevention of entry to foster care. But what if we were trying to actually prevent child abuse, not just entry to foster care? We have the opportunity to lay out the vision, but we would never be able to carry that work alone. We must play a role in advocating for a true prevention continuum.
Thank you so much, Dr. Deb and Lindsay, for sharing your experiences in Oklahoma. It is evident that there is a strong belief and value that your child welfare agency cannot do this work alone, and a commitment to building strong and meaningful relationships with community partners such as Arnall is key for better outcomes for children and families. I will now turn it over to Candace Fleming and Kimmy Wynn Hummingbird, who will share their experiences in building a prevention-focused child welfare system with Native child welfare. Candace, let's begin with you.
Thank you, Dee. Thanks for this opportunity to share the innovations of the Eastern Band of Cherokee Indians. In 2017, the tribe's Family Safety Program partnered with the Quality Improvement Center for Workforce Development to identify, implement, and evaluate a workforce intervention to address child worker retention and prevent early departure from the agency. A little over 2 years prior to this time, the tribe assumed administration of child and adult protective services, which had previously been under the state and county system of North Carolina. It was an opportunity then to partner with the QIC to strengthen social services centered on early, culturally effective services that strengthen families, both nuclear and extended families, and connect them to Cherokee culture. The local intervention team, the unit supervisors, the workers, and the QIC-WD team, the Quality Improvement Center team, embarked on an analysis, first of all, of the workforce's areas of strength and opportunities. In order to identify the problem on which to focus, this process involved examining and interpreting family service programs, family safety programs, recruitment, hiring, and retention metrics and processes. We also looked at organizational culture and climate and other workforce processes and initiatives. The following issues continue to come up time and time again during the needs assessment process: inconsistent onboarding practices, unclear job expectations, lack of knowledge of culturally sensitive practice, and strained relationships across family safety program units due to a lack of full understanding of all agency services. This knowledge led to the selection of onboarding as the workforce intervention for the project. To address these issues, a 5-week onboarding program included a structured interactive review of family safety programs, policies, and procedures, an incorporation of a mock family case to illustrate the full case process for new workers, inclusion of content related to Cherokee culture, history, and culturally sensitive trauma-informed practice, and the shadowing of all family safety program team units to encourage an understanding of all aspects of work performed within family safety program and to strengthen relationships across team units. A supervisor manual complements the workers' onboarding manual and provides guidance to the supervisor to assist their new hire through the initial weeks of employment. After time with the tribe's Human Resources Department, the days in weeks 1 to 3 of this 5-week program are filled with viewing a welcome video made by supervisors, learning practice philosophy in the integrated child welfare model and signs of safety, watching a cultural video focusing on Cherokee beliefs and history, a tour of a Cherokee museum, and a tour of the various villages in the boundary. Week 3 involved shadowing workers from 3 units. The units are the intake unit, the investigations unit, and the family integrity and preservation unit, the unit that is most focused on prevention. In week 4, the new worker spends time with a team member from the integrated child welfare team and court team, and also with the Indian Child Welfare Act team. The final week is a time to get to know the Adult Protective Services unit and the behavioral health team that delivers mental health and substance abuse services to family safety families. The intervention is expected to be piloted later this summer. When implemented faithfully, we expect to see an increase in worker engagement with the assigned unit and the agency as a whole, an increase in worker retention, an increase in effective partnering with families, an increased use of community services and family supports, and ultimately, an increase in successful outcomes for Cherokee children and their families. We are honored to share these developments with you, and now we will learn about important work done in another Indigenous community. Kimmy?
Good afternoon, and thank you for allowing me some of your time to speak about the Muskogee Creek Nation and our Promoting Safe and Stable Families program. Let me start off with some background about the Muskogee Creek Nation. Our national complex is located in Okmulgee, Oklahoma, approximately 40 miles south of Tulsa. We're the 4th largest tribe in the nation with a population of approximately 88,000 citizens. Led by our principal chief, second chief, and 16 National Council representatives, we have an 11-county reservation area that includes one of the largest counties in the state of Oklahoma, Tulsa. We are a sovereign nation steeped in tribal culture with strong core traditions and beliefs. Our tribal communities continue to thrive today because our citizens value each other, and we recognize that our continuation as Muskogee people is dependent on each of us. At the nation, our Children and Family Services Administration, or CFSA, appreciate and acknowledge these core values and exercise them within our programs. Programs under the CFSA umbrella include the Family Protection Team, which houses our Child Protection Services and Tribal Juvenile Justice. We also have Tribal and State Reunification and Permanency Teams, a Certification, Placement, and Recruitment Team for our foster and adoptive homes. And we are currently in the developmental phase of our 4E program, CFSA was a recent awardee of the 4E Development Grant, and we look forward to implementing this program in the upcoming years. But I'm here today to discuss with you our Promoting Safe and Stable Families program. The purpose of this program is to support the well-being and the stability of our nation through services focused on preserving and strengthening Muskogee families. As Indigenous people, we continue to feel the ripple effects of our parents, grandparents, and great-grandparents being raised in boarding schools. We know that during the boarding school era, our relatives, some as young as 3 and 4 years old, were forcibly removed from their families and sent away for an education at facilities that made every effort to, quote, kill the Indian and save the man, end quote. Many of our children never returned home. Those that did return struggled to relate to their families because of the horrific trauma they endured. We recognize that children who grew up in that setting do not understand what it is to be raised in a home with a parent, and how in turn could those children, when adults, be expected to parent without any role models. Without a doubt, our families continue to heal from this historical trauma today. It is with that recognition and these guiding principles that we deliver our services to our families. Families engage with our program by self-referral, community referral, or in some cases by other service providers. This program is voluntary and the family has to commit to working with our staff. These services are intensive, hands-on, and home-based. Working alongside the family, CFSA staff identify each individual need and develop a plan to meet those needs. We find that most of our families tend to be recognizing behaviors that could put their children at risk for removal, families transitioning their child back home, or shortly after reunification if a family is in need of wraparound services, which serves as an additional support to the family, hoping to alleviate any barriers for successful reunification. I think it's important to point out that all 36 CFSA employees are Indigenous. 30 of us are Muskogee, and other team members include Choctaw, Mississippi Choctaw, and Cherokee tribal citizens. At last count, CFSA staff has more than 250 years of experience working under our roof in Indian child welfare or within other child welfare agencies. We recognize the importance of keeping Indian families together, providing support systems within tribal communities, and community partnership. Most of our staff live within our reservation boundaries, engaging with our families and participating side by side in ceremonies with each other. The current state of our nation has redefined the way we interact with our families. However, we continue to connect through virtual visits. We deliver cleaning supplies, food, laptops for distance learning, and other needs to our families' doorsteps. Within the last 3 years, our Promoting Safe and Stable Family program has engaged with just under 200 families and prevented the breakup of each of these Indian families. We provided 640 transports to counseling sessions, job interviews, employment and training activities, to find a new home, to the grocery store, or to meet any other needs of the family. They have completed 1,600 home visits with our families. Our team led more than 1,400 classes, educating the family as a whole and providing insight to child development, discipline techniques, budgeting, and in some cases, infant massage. The Promoting Safe and Stable Families team participated in 840 case staffings with our families. Staff welcomes dialogue from our families and their support system, emphasizing that their voices are being heard and gearing individualized treatment plans specific to each family. In those 3 years combined, we provided $310,000 worth of direct assistance to our families and with our community outreach efforts. To keep our families aware of the services we provide, CFSA completes monthly community outreach activities. We are currently running TV commercials across the state of Oklahoma, ensuring that our phone number is accessible to any citizen who may need us. We are proud of the fact that in partnership with these families, in the last 3 years, we kept 375 children out of the foster care system. Preserving families, their culture, and connection to community is vital to the continued existence of all tribal nations.
Thank you so much, Candace and Kimmy, for sharing your experiences. I appreciate you sharing the importance of meaningful ways to meet the needs of Native families while honoring their culture, as well as demonstrating the benefits of strong community partnership. This concludes our speaker presentation. Now let's begin the Q&A portion of our session with the full speaker panel. So this first question is for one of our Oklahoma speakers, Lindsay. Your presentation with Dr. Deb highlights how child welfare and philanthropy can partner to fill gaps, pursue innovation, and improve outcomes for children and families. What do you believe has helped sustain this partnership?
The first thing that I would say that has helped to sustain the Arnall Family Foundation's partnership with DHS and the Child Welfare Division is relationships. And not just relationships at the top, but really throughout the organization. These relationships have built trust, understanding, and empathy, which you have to do this work. Another element that has helped to sustain this partnership is the fact that DHS holds up its end of the bargain. Whether it's supporting projects with staff time or financial resources, they truly have skin in the game. Dr. Deb and her team's willingness to entertain our crazy ideas and lean into, or rather embrace innovation, has also been key to this partnership. We have such mutual respect that I know if she says it's something that they cannot do or cannot do right now, I know she's really thought it through and isn't just trying to have less things to do, which she could probably afford to have. I led with relationships, which I stand by as a critical element to community partnerships. But when people leave, and as you all know, they will leave, you come back to the mission and what each partner is trying to accomplish. You find alignment. And in our case, we both want children and families to be happy, safe, healthy, and together. So I believe we'll continue to work together to achieve this.
Thank you so much, Lindsay. Deputy Commissioner Resnick, how has the partnerships with the Family Enrichment Centers been sustained? What is working?
The deep level of community investment by parent leaders is essential to helping sustain the Family Enrichment Centers and the partnership with the Administration for Children's Services. The model has really deep enough roots in the community with underlying values of transparency, flexibility, and co-design. And parents are authentically sharing their experiences, can attest to the partnership's success and value.
Candace, can you tell us more about how this onboarding curriculum will support improving the organizational culture and climate?
I'd be glad to. I think having the supervisors be intensely working week after week during this 5-week onboarding program can really increase the trust between the worker and the supervisor. And then also the attention to the very important, critical, and unique work and contributions that each unit gives to the whole of the agency's outcomes is really another important feature of what we stand for in this work. We've also seen how the culture of a trauma-informed program is really going to be emphasized through this work. And it's not only for the families who are experiencing intergenerational trauma and current contemporary trauma, but also the workers who are involved with secondary reactions to walking alongside these families.
Thank you, Candace. We will be interested in learning how this initiative impacts these outcomes over time. This is exciting work for sure. One objective of this session is to elevate the leadership drivers needed for building prevention-centered child welfare systems. Deputy Commissioners Martin and Resnick, what are the specific behaviors and actions leaders in New York City has taken to move in this direction and sustain it?
Yes, thank you, Dee. So in New York City, we took a very purposeful approach. To lift the FECs off the ground, ACS convened a work group with stakeholders, internal ACS divisions, as well as external community service providers and advocacy groups. And this was really purposeful because we wanted to have the community voice at the table from the onset of thinking about this work. We did not want to create, centers or create programs and then bring them to community. So we met for about 6 months to discuss and inform the development of a primary prevention model of service. At the table were our advocacy organizations, for example, Casey Family Programs. Casey Family Programs actually worked with us. They conducted a national scan of potential models and presented to the work group so that ACS could have a good sense of what these jurisdictions had in operation. We also did several visits that we made by members of the entire work group to New York City. We went to New Jersey programs, which had similar models to help us inform our knowledge, as well as several presentations were made to the group to help us think through potential programming. We also had discussions about funding strategies. How would we fund these programs that were voluntary for families and free? We did planning and implementation, which was ongoing weekly, but it was limited also to ACS for reasons related to procurement. So at a certain point in time, we had to stop the collaborative work and then begin to work internal. Once funding was secured, ACS issued a procurement to have 3 contracts for a 3-year demonstration project. So we are happy to share a copy of that procurement with anyone who requests it. Thank you. And I'll turn it over to Karen, who will tell you a little bit more about the sustainability.
Thank you, Dr. Martin. To help sustain our FECs, the Administration for Children's Services has provided ongoing technical assistance. And the technical assistance provided include things such as regular planning and reporting meetings, trainings on the program components, active external collaborations with health and human service city agencies, annual ACS-sponsored events held to showcase, and ACS FEC planning retreats. Technical assistance provided supports the model and has helped to promote the 3 programs locally and nationally.
Thank you, Deputies Commissioners Martin and Resnick. Next, we'd like several of you to share more about lessons learned in making shifts to building prevention-centered child welfare systems. Let's begin with Kimmy of the Muskogee Creek Nation. What advice do you have for other agency leaders making a large cultural shift to building a prevention-centered system?
Thank you. Yes, so first, recognizing the talent or ability within your team who can best lead this initiative and shift in practice. Understanding that each player has a role and you, as a leader, have to engage with each team member to utilize their best attributes and get their buy-in to initiate the change.
Thank you, Kimmy. We know leadership is a function and not a title. By recognizing the talents of your team and providing each team member with a role in creating the desired change is critically important. Candace, what advice might you have for another tribe that might be interested in developing a culture and climate of intervention?
Well, of course, the culture for many Native communities, it does focus on the ethnic background and historical information that is important when you think about serving a community. And the trauma and resilience that exists together in both the community, families, and the workforce is important to attend to as you talk about changes in culture and climate. We also saw that it was really wonderful to have workers be involved with the aspects of the developing of the intervention. And the needs assessment seemed like a long process for them, but ultimately they were very pleased to be asked the questions of what their experiences were like and what they think might be a solution to the changing the how things are done. So so the bottom line is engaging as many people as you can in using their input.
Thank you, Candace. Deputy Commissioners Martin and Resnick, similar question. What advice do you have for other agencies' leaders in making a large cultural shift to building a prevention-centered system?
Sure, Dee. That is a really good question and one that is very important to us. I think to make the cultural shift requires a commitment to adjust the power dynamic that sometimes exists between government and community nonprofits who deliver the services. So inviting the community providers to partner and help inform the design of a program model is really important. Co-design is a critical aspect of the model that we have here in New York City, which enable the stakeholders, that's the parent leaders, the advocates, the provider agency staff, and the child welfare jurisdiction, in our case here in New York City, to have input into the implementation. Those would be my recommendations.
Thank you, Dr. Martin. And to build on what you just said, especially in the early stages, there was really a great deal of input and feedback into the model and in building trust. Because the model is unlike anything that the Administration on Children's Services has ever done, a lot of work needed to occur early on to ensure that the RFP and contract language clearly describe this new way of working. Bottom up versus top down, intuitive versus prescribed, and anonymous participation versus cumbersome data tracking systems, a community-driven approach versus government-mandated approach. The advice I would give to other leaders is to be comfortable with the idea of not collecting detailed participant data from the beginning and allow trust to occur on the local level first. A true community-driven approach is one that is tailored to the unique needs of families in their communities and neighborhoods.
Thank you so much for sharing these perspectives around code design, trust building, and an approach that is tailored to the unique needs and contexts of families in communities which they live. Dr. Deb, as a state child welfare director, what advice do you have for other child welfare leaders about how to realign resources to support innovative work?
That's a great question because resources are always kind of at a premium in social services. In Oklahoma, the initial investment did require really a strong belief in that idea that child welfare could not do this work alone. And then the faith that the investment of a small amount of resources could ultimately grow. The director at the time scraped together enough dollars to commit to a few positions and enough dollars for a few contracts. And very early on, we made the decision that some of the projects we would do would need to be very well thought out, evidence informed, and could be evaluated because we knew that we would need to protect those efforts against future concerns with budgets or things like that. The agency invested in valuation as well, so that when budget crunches did come, there was evidence of what was working. If we were partnering with a program that wasn't specifically going to be evaluated, we still gathered a lot of data around ensuring that the return on the investment that the state was making was there. It's also important to recognize that there's more than just a financial return that was gained through community partnerships. In fact, many more positives for the state. Child welfare agencies need assistance with everything from innovation, expertise from other fields, and at times upfront funding, as we heard from Lindsay earlier. Child welfare also needs friends, lots of friends, especially those friends who will really, in a sense, witness or speak to the heart, the intent, and the ethic of the agency. Because occasionally in our world, unfortunately, something terrible happens. And it's often easier for communities, for the news to be looking for someone to blame whenever those terrible tragedies happen. And there's just a deep need for us to have people that we're working with who can say, no, actually, I know the intent and the ethic of that agency and the work that they're doing, and who can speak to that. Time after time, our community partners have stood with us during all kinds of good times and also in those bad times.
Thank you, Dr. Deb. Investments in evidence-informed services and evaluation to show impact are important ones to make. I particularly like the notion that child welfare needs friends. Indeed, they do. Child welfare agencies need allies, and it sounds like you have a strong ally in Lindsay and her organization. Kimmy, share a bit more with us about how you and your leadership team aligns beliefs and values across your agency to move the work forward.
Absolutely. So recognizing that the vast majority of our staff is from one of our tribal communities in which we work provides some insight to our families. Relying on those relationships and understanding of cultural values helps to lead our work. We learn from each of the families we work with, and they also learn from us. Hopefully, working together, we can prevent the need for a child to be placed in foster care and educate our communities on child abuse and prevention.
Thank you, Kimmy. There is incredible power in partnership. So here's my final question, and perhaps one of the most salient of all. How have families benefited from this work? Let's begin with Director Lopez.
The Hunts Point Longwood FEC families benefit from having their voices amplified. The community works with the staff to create offerings that support the need identified by the community. The community members are the experts of their neighborhood, their block, their building, their home, their families, and especially themselves. Co-collaboration allows us to be effective in the support we offer. Through co-collaboration, we pivot support frequently to address current and specific issues that come to the attention of the FEC team and the FEC Advisory Board. A few examples are as follows. We just ran a community organizing series where 17 community members participated in a 3-day session on community organizing, group dynamics, and grassroots fundraising. This information shouldn't be kept by us. It should be everyone's information. Parent cafes, a Be Strong family model we use to support and strengthen community connections, is another way that we support families. During COVID-19, we experienced a huge food distribution that we took on, and fresh produce, eggs, bread have been distributed to families throughout this COVID-19 pandemic. These are just a few of the following co-created offerings at the FEC. We pride ourselves in sharing all of the information received by the FEC team and providing them with directly within the community.
Thank you for sharing the importance of co-collaboration with the community to amplify family voice. Kimmy, similar question. How have families benefited from this work?
Well, CFSA assessing the individual needs of each family allows for streamlined service delivery approach to our families. Meeting the family where they are and working together to move forward in a direction that's more beneficial to the family as a whole is the best case scenario. Our families recognize us from our communities. They know we are vested in keeping our children within our communities and supporting them as they grow.
Thank you, Kimmy. This concludes our session. Thank you to all of our speakers for sharing your experiences with us today. This was such a rich discussion about innovative, effective ways of building strong relationships between child welfare agencies, community partners, tribal parent partners, and families, that preserves families and community cultures, and yet shifts agency, culture, and climate to improve and sustain outcomes for children and families. It is our hope that those of you in the audience found these discussions helpful and inspirational in building creative ways to address culture and climate in your child welfare system. Thank you for joining our session. We look forward to seeing you in the next session.